The theme of this unit is the anxiety disorders, the elimination disorders, repetitive negative thinking, and the nature of psychological symptoms. How you understand symptoms is as important for your professional philosophy as how you define mental disorder. They are usually what your client talks about and what they want to change by coming to see you. Many of the disorders that were listed in the anxiety disorders chapter in DSM-4 have been moved in DSM-5, which has a separate chapter for obsessive-compulsive disorders and for trauma and stressor-related disorders. This new organization makes more sense to me, especially grouping post-traumatic stress disorder with the adjustment disorders. In DSM-4, the elimination disorders were in a chapter called Disorders Usually First Diagnosed in Infancy, Childhood, or Adolescence. This chapter has been eliminated in DSM-5, and the disorders that were in that chapter have been distributed to a number of chapters in DSM-5. In this unit, we will be covering the disorders that are in DSM-5 chapters on anxiety disorders and elimination disorders. Repetitive negative thinking is an umbrella process which includes worry, usually related to possible future catastrophes, rumination, which is an intense concern about symptoms and the possible causes of distress, and obsession, which is a persistent idea or impulse that continually forces its way into consciousness. As you read this article, consider how you will inquire about repetitive negative thinking in your clients. For this unit, I would like you to be thinking about the nature of psychological symptoms and how much sense it makes to you to be categorizing people by their symptoms. In ICD-10, anxiety disorders are in the neurotic, stress-related, and somatoform disorders section. In addition to the obsessive-compulsive disorders we looked at in the last unit, this section also includes F43, reaction to severe stress and adjustment disorders, F44, dissociative disorders, F45, somatoform disorders, and F48, other neurotic disorders, which has neurasthenia and depersonalization derealization syndrome in it. DSM-5 has a chapter on anxiety disorders and on elimination disorders, and Costonguay and Altmans have two chapters, one on generalized anxiety disorder and one on panic disorder and phobias. The 1968 article by Mozak and the 1967 article by Mozak and Schulman illustrate how individual psychology looks at symptoms as a part of the person's faulty picture of the world, and emphasize how symptoms are selected and used by the person to maintain this faulty view. As you go through these articles, think about what it takes for a behavior or pattern of behaviors to be explained for you. Ehring and Watson review more than 50 new empirical studies on repetitive negative thinking in different diagnostic groups and discuss it as playing a causal role in the development and maintenance of several diagnoses. Pay particular attention to the section of the article that discusses the causal role of repetitive negative thinking in the maintenance of emotional disorders. Try to apply this to the case discussion for this unit. The recommended reading from Barlow and Durand is the part of the chapter in the text that is about these disorders. There are two cases to choose from for this unit. Remember that through this course you will complete 4 case studies, 2 from the Adler book and 2 from Brown and Barlow. When you are working on one of the Adler's cases, focus on the information you would need in order to complete a DSM-5 diagnosis. When you are working on a Brown and Barlow case, pay particular attention to how their DSM-4 diagnosis might be different using DSM-5, and any additional information you would need in order to make a complete DSM-5 diagnosis. For either type of case, you will complete a HUDAS and present an empathic lifestyle formulation. Your original posting is due January 17th, and your peer responses are due on January 18th. Remember to check out both of the forums as places to make a peer response. There is also a clinical inquiry forum for the anxiety disorders. Review the Level 1 and Level 2 measures, and then propose a question for additional inquiry with a person with one of the anxiety disorders. This is due on January 18th. There is an extra credit question for this unit. What DSM-5 diagnostic criteria include repetitive negative thinking?